Hi Ellie, it's wonderful to have you with us here today. As you know, I'm a spine surgeon, deal with patients who come with back pain, but I understand they come to you a lot more open. Tell us more about what you do and how you deal with these patients.
Well, I'm a physiotherapist and I deal with rehabilitation, particularly after spinal injuries and surgeries. I think we're here today to talk about the fact that part of rehabilitation involves many activities, including sex. Yes. And that's something that perhaps has been poorly covered by healthcare professionals, certainly online literature, and it's something we want to focus a little bit more about.
Yeah, that's true. And in terms of patients with back pain, what do you think? Are they reluctant to get back to sexual activity? What are your thoughts on that?
I think they're scared. I think there's a lot of fear associated with once you've had a spinal injury, you've had a spinal sprain or strain or even a surgery, that the spine somehow is a fragile structure that needs to be protected, and that stressing that in any manner of exercise or activity holds a lot of anxiety for lots of patients. So I think part of my job is to reduce that anxiety and fear across all activities, because actually, as you well know, the spine is a very strong structure that needs to be stressed in different positions in order to heal well. Yeah, so we need to kind of promote that.
But what do you think these patients can do in terms of trying and getting out of this shell and trying and doing more in terms of their sexual functioning? What would you advise them generally?
So generally I'd advise that sex is an activity like any other, a very enjoyable activity, and actually something that's probably going to promote rehabilitation, not just per se for sex, but actually for rehabilitation around the spine, the pelvis, the legs, the arms, all the conditioning things that we would want to do with any patient when restoring them back to function, to rehab. So sex is a particular goal for some patients in which we can set, but it's really the same as any other activity. And the principles of rehabilitation apply, which is to control pain during the activity, to build up strength, to build confidence, and to reduce fear. Within that, there's lots of communication, particularly with an activity like sex, because you have a partner involved. But there's lots we can do, and I think it basically starts with dispelling the fear that they'll damage their spine, because they won't. You know, the activity of sex will promote healing of bone, joint, the soft tissues, the muscles. It's actually a really good recommended way of rehabilitating back to normal activities.
Well, it's great that you say that, because a lot of patients don't know that. And I think a lot of patients would come to you and say, how do we get rid of this pain? So what do you generally advise them? How do they get rid of this pain before they actually think of getting into something like this?
Yeah, so the first thing to acknowledge that pain may be present. You know, part of recovery is challenging the body, which may stimulate pain, and also there may be pain present before you even begin. It's not to be scared of the pain, it's a natural part of healing. Using pain relief either before activity, so before sex, using it after activity can really, really help. We find that sometimes just other sort of aspects of pain control, so things like massage, touch, can really help with any muscle spasm that may be present. It also stimulates intimate touch, which is perhaps a little bit less threatening than full sex early on. Another useful thing is maybe heat, and particularly for this group of patients, sharing a bath together, again to stimulate that intimacy can be really helpful to reduce fear and anxiety about actually performing sexual activity together.
I also understand that a lot of them they sort of are afraid, as you said, because they're afraid to even exercise. So leave alone trying to embark on something like sex. But to help them get into this, are there any exercises you'd say they should do?
Yeah, 100%. So we've touched on already the movements of the spine that are involved in sex are often involved in lots of other activities. So certainly encouraging pelvic activity. So a simple exercise is the pelvic rock, where you rock the pelvis forwards and backwards, and that really helps stimulate blood flow in that pelvic area for healing, but also mimics a lot of the actions that would be required in sexual activity. Of course, leg strength is important. So simple standard squatting exercises are really helpful. Exercises on all fours, using the arms but also using the pelvis, again mimic sexual positions, but also really beneficial for global fitness. So there's lots of exercises that are used in other contexts that actually have carryover. And sometimes it's just pointing that out to the patient, look at what you're doing, that's exactly the movement that you would need.
Yeah, and it really will help them obviously and they can slowly, with their partner, sort of try and do things that work for them.
Absolutely.
In terms of telling a patient, or rather in terms of a patient asking you, when can I be ready? When would I know I'm ready? Do you think you have an answer to that sort of a question?
So I would just say, just start and try. We know that beginning is not wrong. We know the spine is healthy, it's strong, and it's time to sort of try and experiment and challenge. So it should be fun, sex should be enjoyable, but you need to start somewhere, like with anything. So start small, start gentle, gradually build up as your confidence and your strength accompanies that development, that rehab.
Ellie, your advice is far beyond what I think this is what patients really need. That's why they need to come to you, they need to talk to you more. So thank you so much for being with us. It's great to have you with us, and I hope this really helps those who are watching this.
Yeah, so do I. Thank you.
Thank you.